Welcome, everyone. I am just gonna give us another minute or two for people to keep trickling in before we get started. Um, yeah. All right. Welcome, everybody, to our June webinar on considerations for future care. We're so excited that you're all joining us today. Just as a reminder, this webinar will be recorded and uploaded to the resource library on our website um, within a few days, just in case you want to revisit it for any reason. Just a couple of tips and reminders here at the beginning. If you would like to turn captions on, Zoom does have a feature on kind of the bottom part of your screen where you can turn those captions on if you would like. And then just a disclaimer here that this is an educational session, but not intended for the purpose of providing medical advice. One other reminder is that you will see on the bottom of your screen a Q&A button. We would love, as you have questions throughout the presentation, for you to submit questions there. And we'll take a few minutes at the end to go through some of those. And then just a couple of quick announcements for things that we have coming up here at Mission MSA. Our July webinar is coming up next month. That one's going to be on living better at home, adapting your space for life with MSA. It's going to be really great, really educational, lots of practical kind of advice for adapting your home and your space as you are dealing with MSA. And that one's going to be on July 22nd at 3 p.m. Eastern Time. But again, that one will be recorded and uploaded to our resource library. And then just another reminder that we do have some exciting things coming up with our online community, MSA Connect, so stay tuned for more announcements about that. And then for today, we want to welcome Maggie Ivansey. She is from the University of North Carolina at Chapel Hill. She's the center director for one of our centers of excellence there. She is a social worker. She has her master's of social work from UNC Chapel Hill. And she has a lot of experience working with people with movement disorders, including Parkinson's disease, atypical Parkinsonism. And we're just so excited to have her here. She brings a lot of experience and expertise in dealing with disorders like MSA. And I think she has a lot of really helpful information to share with you all today. So just as a final reminder to submit those questions throughout the presentation, and then we'll go through those at the end. So welcome, Maggie.
Thank you so much. I really appreciate the invitation to be able to talk with you all today about considerations for future care. So let me get my slides ready for you. Okay. Hope you all can see those and we'll get started. So yes, my name is Maggie Ivansey, the social worker and coordinator at UNC Chapel Hill's Movement Disorder Center here in North Carolina, and I'm happy to share with you about this topic today. So first off, when it comes to thinking about um, either aging in place at home or looking for care outside the home, the one thing that I want you to take away from this presentation is to be proactive. And congratulations, you're already doing it. You're here attending this webinar and thinking about the ways that you want to prepare for the future. So good job. You've checked off the first box. And the other things are to think about the questions that you have about your future. What are the things that you feel like would make you feel comfortable? What are your expectations, and what are the limitations to those? Do you know people in your support network who can provide you answers to some of these questions? These people could be people on your healthcare team. Maybe there is a social worker on your own neurological team that you could reach out to and talk about the specific your specific situations and what resources might be out there for you. Maybe an elder law attorney, somebody who's looking at the legal aspect of things, a financial planner to help with, okay, do we have enough funding to um, related to this, the care costs? And we'll get to talking about costs throughout this as well. And finally, perhaps a geriatric care manager. Sometimes people are very familiar with the role of a geriatric care manager, but sometimes it's a completely new topic to people. So I always like to include them in this planning because geriatric care managers can be really good at finding resources in your community and providing a lot of the support and connections that it takes to find care in your home and outside of your home. And just to put this conversation in context, yes, we're here with Mission MSA, and I wanted to, I'm not telling anyone here anything new. MSA is a rare neurodegenerative disease, right? And so oftentimes when you're looking for additional support in your home or looking for support outside of your home, you're going to be talking with people in these organizations that are totally unfamiliar with MSA, right? And so a lot of that education and advocacy falls on people living with MSA and their families. And so I think it's wonderful that y'all are connected with Mission MSA and other groups that provide people support around atypical Parkinsonism to help support you in your advocacy and education of those who you come in contact with who are unfamiliar with these diseases. Because uh, it's very helpful just to have additional support in talking about your disease and how others can support you. So these are the common situations we're going to be talking about throughout this webinar today. First one, aging in place. Relying on the support network that you've built or that you're building between your friends, your family, and your wider community to help you live at home. The next one, which there can be a combination of these things, of course, is hiring in-home care. Hiring either an individual or people through an agency to provide personal care at home, with your activities of daily living, like bathing, dressing, making meals, running errands. You can hire people to help you with those things. The next situations would be for looking for more support outside of your home. And these often come from facilities called assisted living facilities or skilled nursing facilities, which means moving from your home to an alternative placement that can provide support for your current care needs if that can't be provided in your home. And then finally, which uh, community care retirement communities, which maybe there's a different name depending on where you live. This is what I'm most familiar with in North Carolina, is these what they're called CCRCs often provide options from independent living, assisted living, skilled nursing, all under the same roof. And so you can transition to different levels of care all within the same community. And you see the dollar signs there. It is often the most or more expensive option. So definitely things to be proactive about and things to think about early if that is a consideration of yours. And we'll keep talking about that. So first, we're going to kind of go from uh, uh, our first situation um, on through the rest of them. So first, hiring in-home care. The first question that I think is important to ask yourself when you're like, okay, I'm thinking that we need some more support at home, is what services are most needed? When you begin thinking about making a list of what tasks someone could take off your plate or assist you with throughout the day, do they look more like companionship care, which does not provide hands-on services? They do, and by hands-on, I mean hands on your body, meaning like they do things like transportation, light housekeeping, meal prep, things to support you by doing tasks throughout your home and providing um, uh, social support in your home. The other support that people can provide are called personal care services, which is the hands-on care. Help people with mobility, dressing, grooming, transferring, bathing. Again, all those activities of daily living that we talked about before. So what services are most needed? Um, and it can be helpful to keep a list of what those could look like. Another ask would be how much time are you expecting to hire for? And you can think about that as in, is there more assistance needed in the morning times? Or do you feel like getting ready for bed is more important? Is there a time when your care partner needs to leave the house for their own appointments or exercise or errands that another person coming in could be supportive of? How often is assistance needed? Is it just one day a week or multiple hours each day? A good thing to keep in mind is many agencies, many in-home care agencies, have a minimum number of required hours to even start services. So oftentimes when I'm talking with families, um, the difficulty in hiring care is they just don't need the minimum number that an in-home care agency is looking for. Um, and so it can be you may be hiring for more hours than you think you need at one time, but oftentimes I encourage people to try it. Just try to see what the support is like, and if it's too much, then you can always take it away. But oftentimes people say, I didn't think that I needed this much support, but now that it's here, I do. So that's often a question that people have to figure out is what are the minimum numbers required from agencies and what are the um, hours that you are able to use within your home. So we'll talk about some pros and cons of hiring through an agency. Some of the pros are they usually have a registered nurse on staff to supervise their care services. They complete background checks. They're insured against, accidents and injuries that could happen. And many times, but not always, they can provide backup support if the person who's regularly assigned, is not able to be there. And then they're regulated by the state. So they are meeting, um, specific standards in order to provide services and care. Cons of hiring through an agency is they're more expensive than privately hiring an individual to come into your home. There's the minimum number of shifts by hour per day that we were just talking about. That can be sometimes a difficult piece to figure out in the beginning. And they may charge you if you cancel a shift last minute or if a caregiver leaves early. So it's, reading the fine print, understanding what all the stipulations are involved with hiring care through an agency. And hiring a private individual, some of the pros and cons here. And I would, it looks like the pros are more for the agency and the cons are more for the individual. This is purely circumstantial and depends on what your specific needs is and what is going to benefit you the most. So I wouldn't read into that too much. But I was just noticing that. But the pros of hiring a private individual is they're self-employed. They're often someone you already know or someone, a friend of a friend that you know, can provide you a recommendation or a referral. So you have more of a relationship that way, a familiarity. They're generally less expensive and there's more flexibility with hours and costs, things like that. The cons is if they're not available, then there's no one coming to back them up. So you do have to work around that aspect. Oftentimes, there's no formal background check unless you do the background check yourself. They may not have formal care training. They may not have gone through all of the standards that someone who is working through an agency has met because they're standardized, and they may not be insured. So these are the things to take into consideration when you're considering hiring someone to provide care in your home. So yes, I said we were going to talk about the cost. So let's say, how much does this cost when you're thinking about hiring someone for in-home care? Number one, health insurance does not cover long-term care or hiring someone to come into your home. It's a myth that Medicare or private health insurances will provide this coverage for personal care services. The caveat to this is I recently learned that some Medicare Advantage plans have a limited number of hours that they will provide personal care services. It's usually what I've heard is about 50 to 80 hours a year that they'll provide. So if you are someone with a Medicare Advantage plan, or a private insurance, I would definitely call up and talk to your insurance provider to see if they have that benefit because I've heard of a few recently who provide, again, a limited number of hours, like 50 to 80 a year, which is not nothing, but people often need a lot more than that. So definitely check that out if that applies to you. But generally, health insurance does not cover um, uh, uh, services related to personal care and in-home care, room and board at assisted living and skilled nursing facilities. So those costs are out of pocket. Something to keep in mind. Um, Medicaid for long-term care, meaning someone who's going to live at an assisted living or skilled nursing facility, is often how people pay for services related to that care. Also, if you qualify for Medicaid, you could be eligible for what they call personal care services in North Carolina, at least. It may be different other places that people would be able to provide care in your home. They come out, they do an assessment, and determine from that assessment how many hours per week that they can come in and provide care. That's covered by Medicaid. But again, there's income and asset eligibility that must be met first. And lastly, long-term care insurance. If you have long-term care insurance, which is becoming more and more rare, not employers are not offering it as often, is long-term care insurance is exactly what this is used for. So if you have it, it's important to kind of look at the specifics of your policy and see how much you've paid into it and specifically what it will cover, because all of the long-term care policies are a little bit different. Some of them have a per diem per day about the cost that they can provide for. Some of them are more a la carte for different services. So you have to see what it specifically looks like for your policy on what they will cover and what that looks like. And when it comes to in-home care costs, hiring through an agency, the general costs that I hear are between 25 and $35, 35 being more common. But somewhere in that range is often per hour hiring someone from an agency for in-home care. Usually, um, someone you're hiring privately, an individual, can be between 20 and 30. So that's a little bit of the differences of those costs. And and I'm going to pause there about costs, but we'll talk about them a little bit more throughout the presentation. So where do you find home care workers? If you're looking for someone who is an individual that you privately hire, like I said, oftentimes it's someone you know through family or friend connections. You can ask community groups that you're involved in. There are some places like care.com. Sometimes your local senior centers or county departments on aging will also have a list of people who have been recommended to them, who they've made background checks on. It just depends on your county, your area, on if that's a priority that they have looked into or not. For in-home care agencies, if you're looking for who's available in and around you, local senior centers often have lists, your county departments on aging, and your healthcare team. It may even have a list of agencies that are commonly used in the area. So I think it's always helpful to have some tips on interviewing agencies about like how do you even where do you even start when you're calling these people up and saying that you need help, right? Like what are the things to ask? What are the things to know? So I wanted to offer a few of these questions here that have been common ways that people interview agencies when they're thinking about hiring them. And I really like this first question, and I think it's important, but how do they sound over the phone? Do you feel listened to? Do you feel like they're taking you seriously? I think that your intuition and your gut check around when you're hiring people to come into your home is really important. And so definitely take that into consideration and always encourage people to talk to a variety of different agencies. I don't think that it's wise to just call the first place that you think of and make the decision there. I definitely think it's good to get a variety of of different phone calls that you've interviewed people with because again, we're going back to cost. The costs of these services vary widely, and the things that they can provide can vary too. So it's important to kind of get a good idea by talking to a lot of different places. So again, these questions, how long have they been in business? Do they offer a patient's bill of rights? Do they describe how they put together a plan of care? And do they include input from the family? And if you're going to use long-term care insurance, do they use it? And do they take your insurance? Few more questions, really getting to understand if you're going to have a consistent person who's coming to your home each day, each week, or if it's really going to change. And is that going to be a good fit for your family or not? So what is their staff capacity and what can they guarantee to the best of their ability? How does an agency communicate across caregiving shifts if they are providing that? What's their procedure for resolving problems if they occur? I love that question because you can learn a lot from how people answer it, right? Like if they aren't sure how they resolve problems, that, may be something that they need to work on. And if they have protocols for how they go through things, you can see that they have they've done this before and they take it seriously. Again, what's their protocol for a replacement if someone's unable to come? It's good to understand that very early. And what kind of training do they provide? And these are some tips for interviewing someone privately. How do they present themselves? What's their background with working with an older adult? Can they do their own background check? Do you want to do the background check? How much do they charge? What happens when they're sick? How do you navigate those conversations? How do you decide on the specific tasks that you want them to perform so that you know that you're not asking them to do anything that they're uncomfortable with or that they have no experience with? How attentive are they to the care recipient when meeting them? And, good questions. Do they have reliable transportation? So, assisted living there at the top and skilled nursing. A little bit more information about these facilities. An assisted living facility could be part of an independent facility or part of a larger retirement community to provide support for activities of daily living like showering, meals, housekeeping, and social activities. Um, and then skilled nursing provides room and board, daily care supervision, and 24-hour nursing care. 24-hour nursing care would not be available at an assisted living facility. Um, and a skilled nursing facility would provide all your personal care needs, medication reminders, and medical care there at the facility. So when it comes to planning for the future, I always encourage people to really think about the big picture and that you don't want to be moving multiple times, right? And so if there is ever a big move to make, um, you want to be sure that you are getting the most support possible in those moves. So I think that that is an important thing to consider when you're thinking about moving to an assisted living. If you think that maybe you would need skilled nursing um, down the road, when do you want to make that decision? Or what are the scenarios where you would choose differently, either staying at home longer or just limiting the amount of times you have to move is really important for everyone to streamline things. So definitely um, keep that in mind. When it comes to cost for assisted living and skilled nursing facilities, I often hear the numbers between $3,000 and $6,000 a month for the costs related to this. And so that is also a big consideration to have when you're thinking about if this is what your expectations are and something you feel like you're able to do. Cost can be a huge part of it, and overall expectations of what you want for your future care. So let's talk a little bit about continuing care retirement communities. Again, important to be proactive. Many people delay considering CCRCs because they think they don't need it yet. However, it's often a requirement in order to be accepted into these living communities that the person is active and independent. So in order to be a part of the umbrella of care that they provide, independent to assisted living to skilled nursing, you have to be accepted into their program while you are still independent and active. And so that takes some proactivity. That takes being, they often have long wait lists, which means that even if you are accepted and you're just waiting, maybe they don't have a spot for you for years, which is often can often be a concern. And again, cost can be a prohibitive factor for many because the costs of these facilities can range widely between, I don't know, possibly like in the 6,000 to $6,000 to $10,000 range um, for this care in these kinds of communities. So, definitely not something to delay if you're considering this kind of care, if you want it to be all encompassing and definitely answers the question for you around moving, just making one big move. Well, if you just want to make one big move, CCRCs can provide um, the transitional care for you all in the same place. So that is what makes it very appealing. But for many, is cannot be an option either because of the wait lists are so long or the costs are so high. And again, this would be out of pocket. Not familiar with these communities having um, uh, or providing Medicaid as a payment form or anything like that. So definitely something to consider. Other considerations. So there are, depending on where you live, depending on the resources within your county, within your state, there are programs called adult daycares that can provide socialization, enrichment, and supervision throughout the day for care partners and family respite. There are some adult day programs that can offer a overnight respite. Um, I know of a few places who do this because a common question that I hear from families and care partners is, well, if if a care partner has a health condition which puts them in the hospital for a few days, how do they get support for their partner? Or if they need to go out of town for any reason and would want support, how do they arrange that respite care? Some adult daycares can provide this. Um, there are some respite organizations that can do this as well. But I'm being very general and vague because it really, really just depends on where you live and the resources that are available there. So definitely encourage reaching out to your county department on aging if that is a question that's come to your mind and you're like, how would I make this situation work? Those would be the people to talk to about what's available in your area for that respite support. And then I also often include memory care, can be a different level of care within a skilled nursing or assisted living facility, specifically tailored to people who are affected by dementia and the unique needs that come with cognitive difficulties. This is not something that I see very often in MSA, but always wanted to, provide just that additional information about what other families are doing related to long-term care and uh, just so you are kind of familiar with the language if you see it as you're exploring different care options. And I always like to share with people about the benefits through the VA. The VA does provide aid and attendance or like housebound benefits for people who qualify through connection. And we've often been surprised, or our patients have been surprised if they are veterans, but maybe haven't ever connected with the VA because they don't think that they have enough connection time or anything like that. We always encourage people just reach out and see what benefits are available to you, even if you don't think that you qualify. just get that information for sure, from the VA themselves, because oftentimes our patients are very surprised that they can receive benefits that they didn't know about. So definitely encourage looking into aid and attendance. I've provided the criteria here about the what uh, makes someone eligible specifically for the aid and attendance and housebound benefit. Um, and then there is one additional benefit called the homemaker and home health aid care through the VA. So this would be an in-home care person completely covered through the VA coming to your home. Similar, they'd come out, they'd make an assessment, and they would let you know how many hours per week that they could provide um, in-home care. So definitely, if you're a veteran, I highly encourage you to look into these programs to see um, what you might qualify for. It also reminds me um, that going back to in-home care and hiring people, that oftentimes in your local county or Department of Social Services or Department on Aging, these these organizations often are looking for grants or applying for grants specifically for in-home care aides. So there may be an in-home care aid program through your county that provides these services. And you can complete an application, and oftentimes there is a wait list. But I have heard lots of stories from the families that I've worked with that they've reached out to these organizations, they've filled out the application, they've gotten their name on a wait list, and then uh, sometimes a year or years, they've gotten help. These people were really proactive and did it very early, and then it ended up benefiting them. Um, but sometimes in just a few months, they can have some in-home care support through a local county organization. But it just depends on, again, where you live and the specificity of that. So my final takeaways, I'm looking forward to your questions and getting into some of the nuance of this. Um, be proactive. These are conversations to have with your family early and often, because uh, our mind can change on the things that we think we want, on the things that we think that we're capable of, the expectations that we have of of our care partners, of our family members. It's important to keep this conversation going about what your plans for the future are and how you can prepare for that. It's really a gift to share with your family about what your expectations for your future care are, so that they can plan and make sure that they are caring for you in the ways that you want to be cared for. So I think that is all. Thank you so much. I'd love to answer any questions. I'll stop sharing my screen.
Thank you so much, Maggie. That was a really great and super informative presentation. We have a couple of questions so far, but please, for those of you watching, feel free to keep submitting those here in the next few minutes. We would love to get to as many of your questions as possible. Um, I guess for now, Maggie, our first question is how do you know, when to get additional help at home for someone with MSA? Like, kind of what do you look for to know, like, it's probably time to get some extra help?
Yeah, that is such a good question. I think that it starts with examining your own limitations on the care that you feel you're able to provide as a care partner to your loved one with MSA. And if you are feeling stressed, if you're feeling um like you could use some help, that is the time um to start saying, hey, maybe I should be reaching out to talk with some agencies, to talk with my healthcare team about what's available near me for additional support and respite. Um, I I think that it's really a really personal decision that that takes both care partner and person living with MSA to talk together about what is going to make you both feel comfortable and supported. So that's where I would start.
Yeah, absolutely. Thank you. Um, Another question, and this one's pretty general, but what's some maybe important paperwork to have done, when you're kind of thinking about all of this? Um, which again, I know is very general, but kind of what comes to mind as far as paperwork you should have prepared.
Yeah. Um, So when you say paperwork, and if you are listening to me answering this and you want to provide more context in the chat, please feel free, because what I think about when we talk about paperwork is advanced care directives, which can be helpful when thinking about what your expectations for your medical care look like. Um, and and I think that those documents, which are often called healthcare power of attorney and living will, those documents can be very helpful in saying, this is what my expectations for my future care look like, and leads into a really good conversation about long-term care as well. Those documents don't often include information about long-term care. But I think that when you're talking about who's the healthcare person that you would want to make decisions for you if you are not able to, and what are those medical decisions that you feel comfortable with them making on your behalf, um, really leads into that conversation about what your expectations around long-term care look like as well.
Yeah, absolutely. Um, I just want to answer a question about um, having access to this presentation. We will, like I said, upload a recording of this to our resource library on our website, and we'll email that out to everyone who registered for this webinar. So you can expect that within the next week or so. But feel free to reach out to us if you have any other questions. Maggie, another question for you would be, um, do geriatric case managers work with individuals who aren't in the geriatric age range?
I love that question. Um, yeah, I don't think that they really have an age, like an age cutoff or a minimum age requirement. So yeah, I would definitely reach out. I would feel fine reaching out to them and explaining your situation and the case by case nature of your situation, because that's what they do, is they look at things by case basis. Um, if I'm trying to think, sometimes you may have uh, a case manager through your insurance. Again, that would be like an insurance question to ask to see if that's available specifically for you. But they may only be helpful in regards of navigating your healthcare system and may do less in regards of long-term care. So I would reach out to the geriatric care managers first. I don't think that they usually have a minimum requirement.
Thank you. Um, so another question for you is, you mentioned in your presentation, trying to avoid moving more than once when you're thinking about the care that you're receiving. Um, like, how do you sort of think about that if you don't need much care yet? Um, yeah.
Yeah. Yeah. So I think the big picture that you think about is first, like what in those common situations is your goal? Do you want to remain in your home? Are you comfortable um with people coming into the home and hiring care that way? Or is your thought and plan is eventually I will need the support of a skilled nursing facility or an assisted living facility. And if the skilled nursing or assisted living facility is something that you're considering in your plan, then um I would look at places that provide skilled nursing assistance because sometimes people can get stuck in the assisted living, and then either need to hire additional care on top of the care that the assisted living provides so that they can get all the support that they need because the assisted living's just at capacity for the support that they can provide. Um, and they can be limiting in that way sometimes, and skilled nursing can provide more care. I hope that that made sense.
Yeah, yeah, I think so. Um, okay, another question. What is the best way to keep tabs on what's happening in the home when you have an in-home caregiver while you're not there? So maybe you're this person's care partner or family member, and you want to kind of keep tabs on what's going on.
Hmm. This would also be a question that I would talk with the agency about. If you're hiring through like a home caregiver, if you're hiring through an agency, because I know that that some families, provide like put cameras in their homes, and but you would kind of need to let them know that that was something that you're doing. I don't think that that's like a concern. I think that's a common practice, but that is something that I've heard of other families doing, or just having, it's in that interview that I shared about that you could ask that question specifically on what are the ways that you are going to be in communication with me if I'm gone, or if this XYZ scenario happens, um, how are we going to communicate with each other, and how are we going to have clear communication between each other? It's definitely important to have that conversation in the beginning process before you invite somebody into your home. Know how that is going to happen.
Mm, yeah, for sure. Um, could you provide more details on what a geriatric case manager would do, and then how to find one other than through your insurance?
Yeah. No, thank you for asking that clarifying question because you wouldn't find a geriatric care manager through your insurance. I said that you may find a case manager through your insurance. They sound very similar. But one specifically navigates the healthcare system for you. And a geriatric care manager can provide services related to helping coordinate your medical appointments, helping you find agencies for in-home care, helping you interview the agencies for in-home care, helping you find facilities for long-term care, and coordinate all that goes on in those conversations and keeping it streamlined for you. Um, that's what they do. That's what they're good at. And geriatric care managers um, also vary a little bit. So how you find them is is I often just find them searching online in my area and community. So if you have a social worker that's on your team, or you have somebody who can connect you with resources in your area, reaching out to that person and saying, this is a service that I'm interested in. Do you have a list of people who provide that in this area so that you can reach out to them that way?
Mm. Um, so what if you have a situation where maybe the caretaker and the patient are not on the same page as far as what they're looking for or whether they want to be in a facility in the future? And then this person asked, is a social worker a good place to have kind of a more detailed conversation and help make a decision?
I love this question, Karen. Thank you for asking it. Um, yeah, this is you're so right. There are so many times when, patient and care partners have different expectations, have different view of the situation, and needing to get on the same page together. A social worker is definitely the person you would reach out to say, "Hey, let's have a conversation together about what this looks like." And if you have that person on your healthcare team, that's great. If you don't have that person on your healthcare team and that's something that you're dealing with, I think that uh, there are social workers who are therapists as well, and this would be a really good um, thing to talk with them about too. Um, Yeah. But I think you're totally right, Karen. Um, Having a detailed conversation about what the future looks like and how to plan for it could be very helpful.
Absolutely. I know this is kind of a broad topic, but are there any pros and cons you could talk about when thinking about like a group facility or group home?
Yeah. So thanks for bringing that up. I didn't touch on it as much just because um, it doesn't come up as often, but I definitely have situations where people are living in group homes, or often called family care homes, and they can be really great. What's great about a family care home is it's literally a home where I think maximum in North Carolina is 6 people are being provided care. And so there's a lot more one-on-one interaction. There's a lot more one-on-one care. But again, the same kind of interview process for these places is important. Like, it's important to talk to multiple group homes, family care homes, to kind of get a feel for the kind of care that they provide in those homes, the kind of staff capacity that they have, what their activities or enrichment looks like in those places, and to understand just everything that they can offer to you. But I've heard really great things about family care homes, and especially the individual care that can be provided there.
Thank you for touching on that. We've got time for one last question. And so this person is asking, what if a family member is taking care of a patient's needs, but isn't comfortable with maybe certain aspects of that, like bathroom needs or other, things that can just be a little bit more difficult? What do you recommend there?
Yeah, this is what I'm talking about when I'm talking about limitations and the capacity that you have for providing care. It's important to have these conversations about, well, I'm not comfortable with the bathroom needs, so we need to think about a plan together about hiring someone to provide that support. And what does that look like? Do you have someone who's coming during the day, and do you have somebody at night? Is that something that your family is able to maintain for a long period of time? Or is this where you need to start having the conversation of we need to look for care outside the home so that your full needs and support can be cared for in the proper way. And so that is a super good question, a super difficult question. I want to emphasize how like hard that conversation can be to have with your loved one too. Um, but it's necessary for you both to be able to prepare and make a plan to move forward with what's the best outcome that's gonna be.
Yeah, absolutely. Thank you so much. And thank you all for submitting those questions. We really appreciate it. Maggie, this has been such a great presentation and discussion, and we just really want to thank you so much for being here and talking through all of this.
Oh, thank you. I really enjoyed spending the past hour with y'all, and thanks so much.
Yeah, of course. To those of you who are attending, I am about to send out a really short, brief survey just to get your feedback on today's webinar. It's really helpful for us when we're planning for future webinars. So I'm going to launch that now, and then Maggie and I are going to hop off. I'll give everybody a couple minutes to it's just 2 questions, just to answer those, and then we'll end today's webinar. Thank you all so much for being here. We really appreciate it. And again, feel free to reach out to us anytime if you have questions.